Hi there. My name is Lisa Dow, the physiotherapist behind the Keep Breathing program. The Keep Breathing program is a virtual program for people with chronic lung disease. I've developed a program that involves exercise, education, and support provided at a very low cost. The Keep Breathing program provides live virtual exercise sessions twice a week for about an hour. We also have an extensive recorded video library of exercise sessions that our participants can participate in. For those times when they have to miss a session because they have a doctor's appointment or another type of appointment, or if they simply want to have extra bonus sessions. We also do a chat night one Monday evening per month. That's an opportunity for us to provide some education and support and to meet the needs that our clients present to us. Really importantly, the Keep Breathing program provides support for people with chronic lung disease. The support is ongoing. They get support from me. Importantly, they get support from each other, and they also have access to a private Facebook page where they can connect with each other in a safe place. And on that Facebook page, they also have access to the recorded chat night sessions, the recorded exercise sessions, and also many of the resources that I have created for them. The Keep Breathing program is run out of the Evolve Wellness Studio in Belleville, Ontario. In the yoga studio, I have ample space with a very large monitor that I can closely keep an eye on the people in the program. I have a home gym that I sometimes run some of the some of the sessions out of. And there are times when we invite the Keep Breathers into the Evolve Wellness Studio facility to commemorate some special occasions and to commemorate milestones reached. Fortunately, the Evolve Wellness Studio is owned and operated by Jessica Purchase, who is herself a dedicated exercise professional who believes in providing programming for all those that need it. Our chat nights are based on what the group um, tells us what they are interested in learning about, what their gaps are in their education as far as their lung disease and beyond. We have chatted with respiratory therapists, occupational therapists, lung health nurses, psychotherapists talking about anxiety when you can't breathe. We've had pharmacists come as guests, dietitian. We have had the COPD athlete from Australia join us. He is such an inspiration. We've had grief counselors, personal trainers, residential transitionalists. We've had many people, professionals lend us their time and their expertise, which we are grateful for. Through the chat nights and through my extensive experience in respiratory rehab, I've created a whole series of resources that our clients can use to help improve their self-management of their lung disease. We know that the better they manage on a day-to-day basis, the better they do long-term. These resources they can use as preparation for some of their medical appointments, and they can also use these resources to manage their day-to-day symptoms. We've had great feedback from the use of our resources, both from the clients that use them and for the medical professions on the other side of their appointments that find that the Keep Breathers, when they come in for their appointments, they're very well prepared. They know what questions they want to ask, and they're very prepared to participate in their care. The Keep Breathing program has been really quite successful. Our first class was December 1st, 2020, and we still have 60% of that first class attending our sessions today. In 3 years, we've grown by over 900%. We have greater than 300 attendances per month. We have really great adherence to our program. More than 70% of our clients attend more than two-thirds of the classes that they are enrolled in. And of the total attendances possible in a month, we have 80% of those attendances full. So we have a lot of people that uh, participate in the Keep Breathing program very, very regularly. Some have 100% or close to 100% attendance. Who should be referred to the Keep Breathing program? Well, anybody living with chronic lung disease. Often we think about COPD, asthma, and pulmonary fibrosis and bronchiectasis, but we also have adults with cystic fibrosis. We have many pre-lung transplant clients and a few post-transplant clients. We're starting to have some post-COVID clients, and we do have some people that are post-lung cancer treatment. Referring to the Keep Breathing program is pretty easy. You can provide your clients with our contact information. We have lots of referral cards available. But really what works best is if the referrer sends me the client's contact information, of course, with their consent. So either by fax, by email, or by simply calling me. It's really terrifying for people who have lung disease to even think about exercising sometimes. So sometimes that's a barrier. It usually works better if I can call them and reassure them and talk to them about what the program is about. So once I get your referral, I do contact the client quite quickly, often within the first 48 hours. And on that initial contact, if they're interested, I do a screening with them. We go over their respiratory history, we go over their medical history, any of their concerns, what their goals might be, and I teach them about self-monitoring. Often they have some education needs that I can help meet right in that very first session. And then if they're ready to sign up and they need a Zoom trial, we practice getting on and off Zoom as well. So often before the client comes to that very first class with me, they might have been interacting with me for a few hours, in fact. The Keep Breathers are a really fun, friendly group. This is some of us. We're not scary at all. We love to have new members, always looking for increasing our group because we have such great results, but such fun as well. If you're wondering where you might have seen me before or what else I do in my time, Keep Breathing does take up a lot of my time, which I'm very happy and love to do, but I'm also involved in many other projects. I was one of the Canadian leads for the World COPD Day Big Baton Pass in 2023, and I'm working with that group again in 2024 so we can get the word out about how people across the world are being active when they have COPD. I'm also the pulmonary rehab virtual program for the Kingston Lennox Addington Ontario Health Team, their COPD integrated pathway. So I do that. I also run a program called Keep Moving out of Evolve. I've done lots of work with the Lung Health Foundation, including their Fitness for Breath program, and they've actually identified the Keep Breathing program as an ideal format for Fitness for Breath. I do some work with the Healthcare Excellence Canada, working on some projects about innovative healthcare, providing virtual healthcare. We actually just won a nice award about our programming that we do. And then through Health Excellence Canada, I'm also working two other programs, Keep Standing, which is a balance training program, and Keep Caring, which is a program geared for those that care for others. Thank you for listening to me. Thank you to Jessica from the Evolve Wellness Studio for providing the space and the means for us to provide the Keep Breathing program. And also like to thank Hallie Ward from Trudell Medical. She's always very supportive and she does some education with our group on the aerobica. Thank you. Hopefully you will join have your clients come and join the Keep Breathing program, please reach out to me if you have any further questions.